Hey everyone, today I'll be talking about the abnormalities of different waves of ECG. Now, before understanding the abnormalities, first we need to understand the basics of ECG paper. Now, this one red big box consists of small 25 boxes. Each small black box measures 1 mm in height and 1 mm in width. In terms of time, each small box is equivalent to 0.04 seconds. Now this information will help you understanding the normal and abnormal waves. First, what I'll be talking about is P wave. If I talk about a normal P wave, both its height and width are not more than 2.5 mm. That means that the normal height and normal width of P wave is less than 2.5 mm. Also, one thing which I would like to add is that the height of P wave is denoted by right atria and the width of P wave is denoted by left atria. If I talk about the abnormalities, then there are two abnormalities. Either the height becomes more than 2.5 mm or the width becomes 2.5 mm. Now, if the height becomes more than 2.5 mm, that would denote right atrial enlargement. And if the width becomes more than 2.5 mm, then that would denote left atrial enlargement. After P wave, we will move on to PR interval. Now, before I discuss PR interval, there is one thing I would like to clear, that is the difference between two terms, interval and segment. Look at this normal ECG, wherein P wave, then we have the QRS complex, and then the T wave. Now, if I talk about interval, let's say PR interval, then PR interval would mean from the beginning of P wave till the beginning of QRS complex. This is PR interval. And if I talk about segment, let's say PR segment, then that would mean from the end of P wave till the beginning of QRS complex. Similarly, if I talk about ST segment, then that would mean from the end of QRS complex till the beginning of T wave, that is ST segment. Let us come back to the topic which we were discussing, that is PR interval. A normal PR interval ranges from 3 to 5 mm, which in time would mean from 0.12 to 0.20 seconds. Let us talk about the abnormalities of PR interval. Again, there can only be two abnormalities. Number one, that the PR interval is prolonged, and number two, that the PR interval becomes short. If I talk about prolonged PR interval, then that would mean that there is impaired AV conduction. Impaired AV conduction can have various causes. If I talk about short PR interval, then that is seen in condition where accessory pathways are formed. The most common condition would be WPW syndrome, that is Wolf Parkinson White syndrome. Next, what we will move on to is the QRS complex. Now, the normal width of QRS complex is 2 to 3 mm. So the abnormality will be a wide QRS complex. A wide QRS complex can be seen in bundle branch block. This bundle branch block may be a right bundle branch block or a left bundle branch block. Davidson also talks about the amplitude of QRS complex, and it says that a large QRS complex can occur in slim young patients and in patients with left ventricular hypertrophy. Next, what I will be talking about is the ST segment. Now again, I'll be drawing a ECG wherein we have the P wave, QRS complex and a T wave. Now if I talk about normal ST segment, a normal ST segment would mean that it is in line with PR interval. Now what do I mean by that? I'll explain you. In this diagram, this is the PR interval. I'm sorry, I'll draw it again and explain it again. In a normal ECG, this is P wave, a normal QRS complex and a T wave. Now, this is PR interval and this is ST segment. Both the PR interval and ST segment should be in the same line. If this ST segment goes 1 mm above the baseline, and by baseline I mean that when we extend the PR interval till here, this is the baseline. then this is known as ST elevation. Similarly, if the ST segment goes 0.5 mm below the baseline, then that is known as ST depression. So I'll repeat ST elevation and ST depression again. I'll erase this and I'll repeat it again. Say this is an ECG, a P wave, a QRS complex, and a T wave. Now here, if we extend the line of PR interval till here, then we can see that this ST segment and the baseline are in the same line. If this line of ST goes 1 mm above, then that is ST elevation, and if this line of ST segment goes more than 0.5 mm below the baseline, then that would be ST depression. So you must have understood that there are two abnormalities of ST segment. One is elevation and one is depression. If I talk about ST elevation, then it is seen in conditions like Prince meatal angina and ST elevation myocardial infarction. If I talk about depression, ST depression, then ST segment depression is seen in unstable or say the classical angina and non-ST elevation MI. Next, what I will be talking about is the abnormalities of T wave. Herein, I would like to mention two common abnormalities. Number one is a tall, pointed T wave which is seen in hyperkalemia. And a T wave having a broad base and is rounded. This type of T wave is seen in hyperacute myocardial infarction. Now, I would like to make one thing very clear, that there are a lot of abnormalities in every wave and there are many causes for those abnormalities. But as I have mentioned, I'm just touching upon the basics of ECG and trying to make things easy for you. If you like this video, make sure to like, share and subscribe. Thank you.